Hi, everybody. This is Dr. Izabella Wentz, PharmD. Today I'm here with Dr. Eric Osansky, and we're going to be talking about Hashimoto's, Graves' disease, and all kinds of information on how to put that into remission. So a little bit of background about Dr. Osansky. He is a chiropractic physician, nutritionist, and functional medicine practitioner who has a practice that focuses on helping those with thyroid and autoimmune thyroid conditions through the use of natural treatment methods. He was personally diagnosed with Graves' disease and successfully got himself into remission through a natural treatment protocol. So you guys know that he's somebody that's coming from the heart and he's very passionate about the work that he does. This is why I'm really, really excited to have him here with me. Welcome, Dr. Eric. How are you?
I'm doing well, Dr. Izabella. Thanks for having me. I'm excited to be here.
Likewise, I'm so excited to have you here. So I think, for everybody at home and just so wonderful to know that this is a very personal condition for you, autoimmune thyroid disease. So can you share with us your story with Graves' disease?
Sure. Well, it started in 2008. 2008, I was just taking my blood pressure at one of those automated blood pressure machines and discovered that I had a high pulse rate. My blood pressure was normal, but the pulse was a lot higher than it normally is. So just like most people in that situation, I continued monitoring it for the next few days and just realized that it was consistently high. And then I started putting some of the pieces together. I wasn't too familiar with hyperthyroidism. I had a basic knowledge, but I was losing some weight, even though I was also dieting and doing some detoxification. So I attributed to that. Same thing with the increased appetite. So those symptoms combined with the increased pulse rate made me make an appointment with a family doctor. And that's when I officially found out I had hyperthyroidism. And I was prescribed, I think it was just a beta blocker at the time. I don't think it was any anti-thyroid medication. I'm pretty sure just a beta blocker, which I didn't take. And maybe at the time I should have taken, but I just decided not to take it. And scheduled an appointment soon after with an endocrinologist, and she's the one who officially diagnosed me with Graves' disease. And she also recommended some medication. And unfortunately, she didn't pressure me to get the radioactive iodine because a lot of endocrinologists do that. So I was appreciative of that. So she recommended methimazole, which is commonly recommended for people with Graves' disease. I held off on taking the methimazole as well. After I went to the family doctor and I found out for certain I had hyperthyroidism, even though I scheduled an appointment with an endocrinologist just to confirm Graves' disease, I knew I was going to take a natural approach. And the reason for that is, in the past, for 7.5 years prior, I just had a regular chiropractic practice, just focused on neck and back pain. But I did take a lot of my continuing education credits was in nutrition. And I took a few functional endocrinology seminars. So I knew there was some natural options for thyroid conditions such as hyperthyroidism. I didn't know how effective they would be, honestly, but I knew that I was at least going to give them a try. And so after visiting with the endocrinologist and getting the diagnosis, I held off on taking the medication. And I took some natural herbs such as bugleweed, which is an anti-thyroid herb, motherwort, which that also helps with the cardiovascular symptoms, and then did things to address the cause of the condition. And, sure enough, just slowly started getting better. Symptoms started to improve. Blood tests started to get better. Had some other tests like saliva tests also starting to improve. And then eventually symptoms were gone. Blood and saliva tests were normal. So I pretty much accomplished a state of remission and have so far maintained that. And then once doing that, I realized that there were so many other people out there like me with thyroid and autoimmune thyroid conditions. So I decided to change things around and have a practice that focuses on, not on Graves' disease, Hashimoto's, and just over the years have obtained more training in nutrition and, getting my master's in nutrition and functional medicine and numerous nutrition certificates. But as you know, the real experience comes with working with the patient. So even though I've learned a lot with the degrees and certifications, it's just seeing all the patients over the years with Graves' disease and Hashimoto's, but that's pretty much my story.
Wow, that's amazing. So you actually got the condition, and you had already had all this wonderful training. So you were able to use some of that training on yourself.
Well, when I was diagnosed, I didn't have I attended some seminars and conferences on nutrition and functional endocrinology. So honestly, when I was diagnosed with Graves' disease, I didn't really have much training, and I worked with another natural healthcare professional at the time to help with me. To help me with the condition. So just like I recommend not to self-treat one's condition, I didn't have the knowledge at the time. So, but over the years, it took a while to gain the knowledge. So I learned about it before I even though I received treatment on my own naturally, I still wanted to learn more. So it's not like I jumped into seeing patients right after getting into remission. I did do some more extensive training, and then again, just did eventually start seeing patients, and that's when the learning began.
Yeah, so basically you actually worked with others who were trained in these methods, and they were able to give you more guidance rather than trying things out on your own.
That is correct.
Very good, very good. It's always best to work with a practitioner. I think part of it is becoming empowered and knowing the things you can do on your own, but also making sure that you're being monitored. Like you went to the endocrinologist to make sure that you were monitored, and then you consulted a variety of practitioners to make sure that you were being safe with all of your protocols. How long did it take you to reverse your Graves' disease?
Yeah, it probably took, as far as once everything was normal, you mean, as far as the symptoms and blood tests, saliva tests were normal, probably about 6 months on average, maybe 6-7 months before everything was normal. I don't think I was completely stable at that point, but everything was, and I noticed positive changes probably within, honestly, probably a few weeks. So I don't want anybody to get the impression that it takes 6 or 7 months before noticing symptomatic improvement with these conditions. But it takes time, and that's an average with me. For some people, it's taken less time. For some people, it's taken a longer amount of time. But in my case, it was about 6 or 7 months before everything was completely normal, test-wise and symptom-wise.
Wow, that's wonderful. That's a really good thing for people to keep in mind. And I'm really glad that you brought up radioactive iodine, because this is something that a lot of people will get their thyroid treated with radioactive iodine when they have Graves' disease without really trying to get into remission. And so that's something that a lot of times in the United States, they'll recommend as a first-line therapy, where in Europe, they'll actually recommend medications first to try to see if a person will go into remission before they would go on and recommend the RAI. And, thanks to you and your advocacy work, we now know that there's also natural treatment protocols that can be used as well. One question I have for you is, this is something that is not very often, but you see it every now and then, is when a person has the antibodies both for Hashimoto's and for Graves' disease. So, how do you work with a patient like that who fluctuates between hyperthyroid and hypothyroid symptoms?
Okay, that's a good question, because you will see people with both types of antibodies. And just for those who are listening who aren't familiar, I'm sure many people are familiar with the different types of antibodies. But for Hashimoto's, we typically see thyroid globulin antibodies or thyroid peroxidase antibodies. And with Graves' disease, we see TSH receptor antibodies with TSI antibodies, or thyroid stimulating immunoglobulins, the most common type of TSH receptor antibody. But regardless of whether someone has Hashimoto's or Graves', we need to remember they're both immune system conditions that affect the thyroid, not the other way around. So when someone has the antibodies for both, typically the goal either way is, of course, to address the autoimmune component of the condition. As far as the management of the symptoms, in some cases, people will fluctuate back and forth Now, honestly, most people have the antibodies for both. It's not as if one day they'll have hyperthyroid symptoms, one day they'll have hypothyroid symptoms. Sometimes that happens, and I'll talk about that in a minute when that does happen. But usually the more common pattern is where they might experience, let's say, hyperthyroid symptoms first, and then they might have that for a number of months and then become hypothyroid. So again, it really does depend on the situation. But there are some people who will fluctuate, and usually when someone has, let's say, they have hyperthyroid symptoms fluctuating with hypothyroid symptoms on a frequent basis, whether it's daily or a few times a week. Again, it's usually not due to the antibodies. Sometimes it could be, but for example, with Hashimoto's thyroiditis, when the immune system attacks the thyroid gland, it'll actually cause the thyroid gland to release thyroid hormone into the bloodstream, which could lead to hyperthyroid symptoms. And it could only be for a few minutes, maybe it's a few hours. But either way, the person could experience some hyperthyroid symptoms, an increased pulse rate, palpitations, and then a few hours later, they might experience hypothyroid symptoms. Now, in that case, it could be a little bit challenging to manage just because you really don't want to give someone with hypothyroidism anti-thyroid medication or even anti-thyroid herbs. And the reverse is true as well. You wouldn't want to give someone with hyperthyroid symptoms thyroid hormone or something that stimulates thyroid hormone production. So it could get a little bit challenging. And if someone is fluctuating between the two, again, I usually won't give any anti-thyroid herbs such as bugleweed, but I won't be opposed to giving something such as motherwort or hawthorn, which can lower the heart rate without affecting the thyroid hormone levels. So that's usually the approach I'll take if someone is fluctuating back and forth pretty frequently. But again, I don't see that most of the time. It's, again, usually if they're having the antibodies for both Graves and Hashimoto's, usually they're predominantly hyperthyroid or predominantly hypothyroid. And again, in the future, they might switch back and forth. But usually, like I said, it's not the same day where they're constantly going back and forth, hyper and hypo.
Thank you so much. That's very helpful. And when I was first diagnosed with Hashimoto's, probably the year before that, I had a lot of these hyperthyroid symptoms where I would have panic attacks, I'd have palpitations, anxiety attacks, and it was just not fun. And like you said, it can be from day to day. You can fluctuate like that, or it can happen for just a few minutes or a few hours at a time, and then you go back to having these other underactive thyroid symptoms. So do you have any patient success stories involving people who had both TSI and thyroglobulin antibodies who were able to normalize them with natural treatment options?
Yeah, definitely. I mean, again, that's the goal, is to try to get someone, if they have, whether they have one or the other, or if they have both, the goal is to try to improve the health of the immune system and try to normalize the antibodies. And yes, I've had people where they have both the TSI antibodies and thyroglobulin antibodies where they normalize. And in most cases, or I should say many cases, I find that there is a common trigger. So if if the trigger is gluten, for example, or whatever the trigger is, by removing the trigger and addressing other compromised areas, usually both antibodies will decrease. Now, there have been cases where I have a patient where I've had patients where one antibody decreases and normalizes, and the other one maybe either lags behind, where maybe it is decreasing but it doesn't normalize, or it's not decreasing at all, sometimes maybe increasing. And then so that's when you have to consider that there could be more than one trigger. These autoimmune conditions could be complex at times, and there could be there's overlap. Like H. pylori, it could be a trigger for both Graves and Hashimoto's, but there's also different triggers for different autoimmune conditions. So it is possible to remove a trigger and get normalization of one type of thyroid antibody, but not the other. And then you got to do some detective work to find the other trigger.
Yeah, absolutely. Absolutely. And, one of the things that I found, and when I first started looking at my own autoimmune thyroid condition and trying to get myself into remission, I was trying to connect all the pieces and all the broken systems within my own body. And, one of the big things that was happening with me is I had irritable bowel syndrome and I had acid reflux. And I ended up finding some work from Dr. Alessio Fasano that talked about kind of this three-legged stool of autoimmunity where you had to have three things present. And those were having the right genetic predisposition, having a trigger, as well as having intestinal permeability or leaky gut. And for me, that was kind of like a big aha moment where I was like, okay, yes, I know there's something happening with my gut, and this is something that I need to address. I know that you, in your practice, do you do testing for leaky gut?
Sometimes I do. It's not a standard test on every patient, but over the years I have done a decent amount of leaky gut testing. There's a few different types. There's the lactulose mannitol test, which is the classic one, and there's a urine test, swallowing a solution of lactulose mannitol. When I do and I have done that type of testing, but usually if I do any type of leaky gut testing, it usually is the intestinal permeability test from Cyrix Labs, which you're familiar with, and that's a blood test, and it's pretty much measuring the immune system response. So, for example, when you have a leaky gut, there's certain proteins. There's occludin, zonulin, tight junction proteins, and actomyosin, which also affects the intestinal barrier. So when you have the immune system, and I got some beeping in the background, so sorry about that. So the immune system, when you have a leaky gut, you typically will have antibodies against one or more. Cyrix will measure the occludin zonulin antibodies, actomyosin antibodies, and then the LPS lipopolysaccharides. But I guess the point is, to get back to the question, I don't test everybody for those. It's nice to do because you get a baseline, but the downside is it's not telling us what triggered the leaky gut, what the cause is behind the leaky gut. So that's, so you still have to do some detective work, even if those tests come out positive. So yeah, I do sometimes do those, but again, not with everyone.
Yeah, I kind of agree with you. I feel like it's good to do leaky gut testing for monitoring to see if you see an improvement. But whether or not, if somebody is having irritable bowel syndrome and if they're having acid reflux, I think we could save our money and, do testing elsewhere to try to look for the triggers and root causes. Now, with your clients that you've tested and patients, do you find that everybody who has an autoimmune thyroid condition will have leaky gut?
Yeah, I have not. And I've written a blog post not too long ago about that, because as you said, there are some theories that, with the autoimmunity, everybody has a leaky gut. But I've had people who have tested for elevated autoantibodies, whether it be high thyroglobulin antibodies or TPO antibodies or TSI antibodies, yet when they had the Cyrix Labs test, the test was negative. And there are some factors that can affect the test and give a false negative too. So you do need to be aware of those factors. So if someone has, it's measuring immunoglobulins. So if you have depressed immunoglobulins, IgA, IgG, IgA, IgM is what they test for. So again, and you could do a separate test the serum immunoglobulins, but if those are depressed, then you could get a false negative. But I've had patients where the immunoglobulins were fine on a blood test, yet they tested negative for a leaky gut on Cyrix Labs. They weren't taking anything else like corticosteroids that could also suppress the immune system. So yeah, I have not. Most people have tested positive, so I will say that it's. But there have been some people with elevated autoantibodies that have tested negative. So that's telling me that either the test isn't completely accurate, or not everybody who has an autoimmune condition has a leaky gut.
Interesting. So I'll be looking forward to hearing more from you on that as you do more testing.
Sure. And I've also, just to add, I've done that with the lactulose mannitol test. I've had a few patients test negative for that, who also had elevated antibodies, autoantibodies. So it's not just the Cyrix test. So like I said, most people, when we do the testing, they do test positive for a leaky gut. But I can't say I've seen everyone who has an autoimmune condition have a test positive for a leaky gut.
Interesting. I know that you have had experience with people who got the testing and they showed improvement on future retesting, as well as their condition improved. And then you've also had people where once they did a retest, their leaky gut got worse. Can you share some of those patient stories with us and reasons why maybe that had happened?
Sure. Well, fortunately, most people, when we do a leaky gut test and they follow the recommendations, usually we do see improvements with future retests. Now, not everybody who does an initial, as I mentioned earlier, first of all, not everybody does the leaky gut test. And those who choose to do the leaky gut test, not everybody does a retest. And usually it's financial, just because, all these tests and combined with supplements and, eating organic food, it all adds up. But those who we have had go through an initial test and do a follow-up test, in most cases, we've seen some great changes, and again, both with, I've seen it both with lactulose mannitol where they, with that, it's pretty much you're positive or negative. And then with the Cyrix labs, you could be out of range, or you could be equivocal, or you're normal. So again, the goal is, of course, to everybody be within normal range. And some people, after a number of months of retesting, their test is normal. Others, it's improved. It has improved, but it's still not normal, which is still good as long as it's a significant improvement. That's still great, and that's telling us that they're on the right track. But yeah, every now and then, I think most pretty much all healthcare professionals have the experience where there are people who just aren't responding, and there could be a few reasons for that. One could be if someone gets a Cyrix Labs test, they test positive for a leaky gut, and we do a retest a few months later, and if we aren't seeing any improvement, then usually it could be due to the patient not following the recommendations, either intentionally or maybe they're just misunderstood. You would think that when spending the money on these tests, as well as everything else, most people are going to be compliant. But again, sometimes we're human, so some people will cheat a little bit and not think it'll make a big difference having a little bit of gluten or something else that might be a factor with the intestinal permeability. Sometimes they're doing everything, they're 100% compliant, and maybe we're just not addressing the right trigger. Maybe we thought that we got the correct trigger, that we detected the correct trigger, but that's not the case. So when they're improving, obviously, everything's great, and we want them to continue doing what they're doing until they're in remission. If we do a retest, and if they're not improving, then of course we want to try to find out, make sure they're following everything. And, if it comes down to having them write a food diary, just to make sure that they're, not eating something that they shouldn't be eating, or doing something. Stress, of course, is a big factor. But yeah, so if they're not improving, we need to do some detective work.
Yeah. Stress is huge. Thanks for bringing that up, because you'll see a lot of people who will be, doing their supplements and their diet perfectly, and then they won't do this whole stress reduction thing at all. They'll just keep putting more stress on themselves, and that can actually prevent a person from getting better.
Exactly.
Another thing that is often stress-induced and associated with stress is this bugger bacteria called H. pylori. There's a lot of research that's connected H. pylori with thyroid autoimmunity. Can you talk a little bit more about that particular infection? How you test for it, and how frequently do you see it in your patients?
Yeah, H. pylori, there's clear research that shows a correlation between H. pylori and autoimmune thyroid conditions such as Graves' disease, Hashimoto's. Seems to be more common with Graves' disease, but I've also had patients with Hashimoto's who have H. pylori as well. And as far as incidence, probably because I test it pretty frequently. That's one that I do test frequently with my patients, and probably I see a test positive maybe about 10%, 5-10%. So again, it's enough where we definitely want to test for it. And as far as different methods of testing, there's blood, saliva, and I'll talk briefly about each of these, but there's blood and saliva. Though if you're initially diagnosing H. pylori, it's fine to use those. Those are looking at the antibodies associated with H. pylori. If you're doing a retest, then you definitely don't want to test in the blood or saliva, and the reason is because the antibodies, if someone's diagnosed with H. pylori, if they test positive in the blood, for example, and then they receive treatment, which I could talk about in a couple of minutes, but let's say they receive antibiotics for H. pylori or whatever type of treatment, and if it gets rid of the H. pylori, the antibodies could remain in the blood as well as the saliva for a number of months after getting rid of it. So you wouldn't want to do a retest with the saliva or blood. The best method in that case would be either doing a breath test or a stool test, which detects for the actual presence of H. pylori. And so that's the approach I will take. Usually, I do a lot of saliva testing with the adrenals, and you could actually test for H. pylori in the saliva. So oftentimes I will just add that on. And again, if that's positive, it depends what the saliva testing I use. It could be clearly positive, borderline, and then it could be negative. If it's negative, it's negative. If it's borderline, then I usually will have them do some further retesting just to make sure. And if it's clearly positive, sometimes they still want to do some other testing to confirm it. But most of the time, the saliva does seem pretty accurate when they are positive. So when we find a positive in the saliva, and if we do a breath test or a stool test, usually it is positive. But so those are the different types of testing. So again, blood and saliva is fine initially, but you can do, of course, a breath or stool test initially as well. And then for follow-up testing, you definitely want to use either a breath test or stool testing. And as far as treatment goes, the conventional medical approach will be to use antibiotics, usually a couple of different antibiotics, just because H. pylori is becoming more resistant to antibiotics. So that's important to understand, because if you go to a medical doctor and if they just recommend a single antibiotic, it might do the job, but it might not. So usually they'll recommend antibiotics anywhere from like 1 to 2 weeks. A lot of doctors will do it for a couple of weeks, and sometimes they'll even do it longer than that. Sometimes there'll be occasionally greater than 2 weeks, but usually, again, everybody's different. Some people will get it for 1 week and it'll do the job, but natural methods are also an option. And I do like the natural methods, no surprise, since I'm a natural healthcare professional, but I do give patients the options. I go over the pros and cons, and it's about 50-50. Some people will choose to take the antibiotics. And the reason is because the antibiotics usually are a little bit more effective, or should I say, the natural treatment, it could be pretty effective, but it takes longer. It could take a few months to get rid of H. pylori if you take the right herbs and nutrients. Like mastic gum is well researched to help with H. pylori, and then some others, berberine, which could help with other pathogens, garlic, matula tea. So there's a few different ones, but again, the antibiotics usually are quicker. Obviously, the downside with antibiotics is that it also could kill and will kill some of the good bacteria as well. And sometimes, again, it is the bacteria becoming more resistant to antibiotics. So even when using combination antibiotics, it still is possible you could receive a few weeks of treatment and still not, and still test negative for that. And I thought I put my cell on airplane mode, but apparently I didn't there. So, but anyway. So with H. H. pylori, with the treatments, again, I give the patients different options as with regards to either antibiotics or the natural approach. And as I said, some people will choose the antibiotics, and some people choose the natural approach. And again, both could work, but you just need to know what to expect. And if you're expecting the natural approach to get rid of the H. pylori within 2 weeks, then that's unlikely to happen.
Mm-hmm. I like to kind of think of the natural approach as kind of like the gentle but longer approach, whereas the antibiotic is kind of like coming out with the big guns. It might take shorter, but you can also destroy some things along the way, like your natural flora. things like that. So, and that's definitely something, it's good for people to have those options, and everybody has to kind of do the right thing for them. In addition to H. pylori, what other kind of infections do you see in people with autoimmune thyroid conditions?
Yeah, Candida probably is one of the big ones, and Epstein-Barr as far as viruses go. So Epstein-Barr is pretty common. Uh, the Lyme disease, so I mean that's a common, Borrelia, which is associated with Lyme disease. Yersinia is commonly associated with both Graves' disease and Hashimoto's. Again, I don't see it as commonly as H. pylori, but that's another one. So those are some of the more common ones. Of course, every now and then, when doing, if I do stool testing, that someone might test positive for parasites, but again, I can't say that most people don't test positive for H. pylori either. But again, so those are some of the more common. I mean, Candida is, as you probably know, that's very common. Candida, and we see small intestinal bacterial overgrowth as well. So.
Mm-hmm. Yeah, and can you talk a little bit more about your experience in working with SIBO? There was a study done a couple of years back, and it showed that about 52% of people in this particular study who had hypothyroidism also had SIBO as well. For people listening at home, it's small intestinal bacterial overgrowth, where you basically have bacteria that grow into your small intestine, and they're not supposed to be there. And this can be a potential root cause of leaky gut as well as autoimmune thyroid disease. Can you talk about maybe your experience with your patients that had that, the kind of testing you do, and what your recommendations are?
Sure. Yeah, SIBO, definitely is something that I've seen more commonly over the years with my patients, and still not something I see in a real high number. But just like Candida, when someone's on antibiotics for a long period of time, or even if it's not too long, I mean, Candida is pretty common. And again, SIBO is a possibility. There's other causes as well. If someone has low stomach acid or low pancreatic enzymes, motility issues. And I mean, some of the symptoms, just for those who might be wondering what some of the symptoms are with the SIBO, bloating and gas, abdominal pain, and it's usually caused by certain types of foods called foods that are high in FODMAPs. And FODMAPs, for those who aren't aware, it stands for fermentable oligosaccharide, disaccharide, monosaccharide, and polyols. So, fermented foods, sugar alcohols, even foods like, broccoli, garlic. But also what's important to understand is not everybody responds to this or has a negative reaction to the same food. So, people will commonly have problems with the fermented foods, for example, although not everybody, but that's pretty common. But for example, like broccoli, I just mentioned, garlic, I'll have some people who have a lot of bloating and gas with other types of foods, but they're fine with the broccoli and garlic. And, so again, if you look at a FODMAPs list, you can't assume that you're going to experience symptoms if you have small intestinal bacterial overgrowth with all these. So again, everybody's different is the point with the foods. And as far as testing, again, this is something I don't test everyone with, because sometimes it's pretty obvious if someone is having a lot of bloating and gas and they're eating the foods high in FODMAPs, and then when they go on a low FODMAP diet, the symptoms improve, then that's a pretty good idea that they have SIBO. Now, I have done some testing. Genova Diagnostics, they do have a lactulose breath test for SIBO. When you have the bacteria in the small intestine, which again, they're normally not you're supposed to have some bacteria, but most of it's supposed to be in the large intestine. So, when you have a greater amount of bacteria in a small intestine, and you do a lactulose breath test, that test is going to look at methane, levels of methane and hydrogen. So you will see those levels on the higher ends. And again, sometimes it's clear cut. I've done Genova testing through Genova where it's pretty obvious they have SIBO, and oftentimes it does correlate with the symptoms. Other times it's a little bit iffy with the results, and you can get false negatives with the breath testing. So again, if someone has some obvious symptoms yet they have a negative, it's a negative test, a breath test, it might still be a good idea to do some things to treat for SIBO. And as far as approaches to take for small intestinal bacterial overgrowth, again, just like H. pylori, you could take a conventional medical approach, you could take a natural approach. The conventional medical approach usually involves taking antibiotics, with rifaximin being the most common antibiotic used for SIBO. And then, if you're going to use natural antimicrobials, some examples I mentioned: berberine for H. pylori, oregano oil, higher doses for both. But the thing is also, either way, what you need to keep in mind is with something such as SIBO, and same thing with Candida, but since we're focusing on SIBO, if you take, regardless of whether you take rifaximin or if you take natural antimicrobials, neither one of those are doing anything for the cause of the SIBO. So if someone, for example, has low stomach acid, then you definitely want to address this. Want to address the low stomach acid. If they have some type of motility disorder, you want to address that. And again, you could take medication for that. There are some herbals for that. But again, if pancreatic enzymes, if you have a deficiency in those, then again, and that's why with both SIBO and Candida, what you commonly see is people get treatments, and then a few months later, it comes back because everything they're doing is focusing on getting rid of the infection, but it's not improving the environment of the gut and the immune system to prevent it from coming back. So so you need to do both of those things when addressing SIBO.
Yeah, that's very, very helpful. And, a lot of times people with thyroid conditions are going to be misdiagnosed with acid reflux, and they'll be put on medications that suppress their stomach acid. And this actually happened to me. I had acid reflux that was, diagnosed. And the theory is that acid reflux occurs because your body is making too much stomach acid. Well, this is actually not the case for most people. And most people, they're not making enough stomach acid. There are multiple studies that show that people with hypothyroidism, as well as Hashimoto's and Graves' disease, actually don't make enough stomach acid or any stomach acid. So I know for me, taking betaine with pepsin, which is a stomach acid supplement, make a huge difference for in how I felt, and just in being able to finally digest my foods. And, that was one of my big aha moments. So thank you for bringing that up. As far as the motility issue, a lot of times that's another reason why a person may develop SIBO is when their bowels are not moving appropriately. Do you have natural herbal recommendations to help people with motility? What do you typically recommend for a person who maybe doesn't have as good of transit time?
Yeah, there's an herb called iberogast. I don't know if I'm pronouncing that correct. You probably, since you're the pharmacist. But yeah, that's usually what I recommend to help with motility, and that seems to. I know you're probably familiar with Dr. Allison Seebecker. She's the SIBO expert, so I learned that from her and the SIBO conference. So, but yeah, that's typically what I recommend, and I don't know if you have any other suggestions, but.
I know some people have had success using low-dose naltrexone, but that's a prescription item. So they will get, maybe like 2.5 milligrams made by a compounding pharmacy, and that can help. But yeah, definitely that's something I've recently learned is that, you can treat the SIBO, but if you have this motility issue, then you're going to have, and also from Allison Seebecker, is that you can have basically the overgrowth come back if you're not doing these other things. So people will say, my SIBO treatment didn't work, it didn't help, but it's basically because they didn't do the full treatment. They just maybe took the herbs or antibiotics without making sure that they had enough of the stomach acid and that things were moving along the way that they were supposed to be moving. So thank you for talking.
Exactly.
So
Mhm.
with respect to, we're going to get into some of these controversial things a little bit now. I'm with iodine and autoimmune thyroid conditions. What are your thoughts on that?
All right. So yeah, the controversial iodine. So, you know, overall, I like iodine. I mean, I'm definitely cautious with iodine, but at the same time, you get different perspectives from different healthcare professionals. You get some healthcare professionals who recommend their patients to take large doses of iodine, like 50 milligrams of potassium iodide. You'll get some healthcare professionals who will recommend for people, especially with Hashimoto's, to completely avoid iodine, and also with other autoimmune conditions as well. So, I'm somewhere in between. I mean, again, I'm probably more I'm definitely more pro-iodine than anti-iodine, just because iodine is important. Iodine, it's just like any other mineral. Iodine has important functions. Of course, it's important for the formation of thyroid hormone. So I mean, too little iodine can cause hypothyroidism. Too much possibly can cause hyperthyroidism. But of course, that's not to suggest that most cases of Hashimoto's is caused by an iodine deficiency, or most cases of Graves is caused by too much iodine. I mean, it's, again, with iodine, you do need to be cautious. And the problem isn't really with iodine. The problem is with hydrogen peroxide is really the issue, because when you get the formation of thyroid hormone, you get the formation of hydrogen peroxide. And it's the hydrogen peroxide that causes the free radical damage and damage to the actual cells and thyroid tissue. And that could cause the increase in thyroid peroxidase antibodies. So again, it's, so iodine, I mean, of course, taking large doses of iodine could be a problem, but the same goes with some other minerals as well. So, for example, if someone takes high doses of iron, that will cause oxidative stress, that will cause free radicals. But you just don't see people just randomly taking high doses of iron. Usually, you'll see them test first. But again, with iodine, unfortunately, you'll see some people take higher doses without doing any type of testing, but anyway, getting back to the hydrogen peroxide. So you want to make sure, if you do take iodine, there's a few different things you want to do. I mean, first, you want to make sure that you have adequate antioxidants. So glutathione is a well-known antioxidant, probably the most important antioxidant, and it's selenium dependent. So, if you have low selenium levels and therefore low glutathione levels, and you take even small amounts of iodine, that could cause problems, again, due to the, not enough antioxidants to neutralize the hydrogen peroxide. So you want to make sure that you have enough antioxidants. Vitamin C is another one that also could help to neutralize the effects of the hydrogen peroxide. Testing as well is important, I think. Now, there's controversy over the different types of testing as well. So it's not as easy as just going, I mean, if you ask your medical doctor for a test in iodine, a lot of them won't do such testing, or they might do a blood test. And a blood test typically isn't the best way to test for iodine. Usually urine is the best way. And the problem is there's different types of urine testing. So with urine, I like the iodine loading test, but the problem with the iodine loading test is that it does involve taking iodine. It involves taking a fairly high dose, 50 milligram tablet of iodoral. And again, if someone has a reaction to that, then that could be problematic. So another option is you could do just a spot iodine urine test, and you could also test. Some labs will allow you to test the bromine levels. Iodine and bromine, they kind of compete with each other. So if someone has high levels of if someone has high levels of bromine, typically they'll have lower levels of iodine. So that's another thing. If you don't want to do the loading test, then you could do a spot iodine test, as well as look at the bromine. And the lab I use is called Hakala Labs. So they do that. There's other labs as well, but that's the lab I use. And so that's so again, testing. You want to make sure the antioxidants are sufficient. And then if you do take iodine, I think it's a good idea to start with small doses. I really don't think that it's a good idea. And in my opinion, I know a lot of people have taken higher doses and have done fine. Some people have taken real high doses. And again, sometimes it works wonders, but you just don't know who's going to do really good and who's going to have a negative reaction to iodine. So usually if I do recommend iodine, it's starting with a lower dose and again, doing some testing first.
That's great. And so basically for people listening at home, I would recommend doing something like this under a doctor's supervision and make sure that you have the testing done and you get your ducks in a row. Because I think where it gets dangerous is when people kind of self-experiment on their own without really getting their levels tested. Like, you said with the iron, iron overdoses can be fatal. And, maybe iodine overdoses are not fatal, but they can still cause a lot of oxidative stress and potentially accelerate thyroid tissue damage, which, we definitely want to avoid that. And we can do that by making sure that you do the right testing and that you do kind of the companion nutrients and work your way slowly with it so that we're not running into using too high of a dose because, a lot of times people think that more of a good thing is really great, but it just depends on the nutrient. It depends on the person. And, iodine and selenium and thyroid hormones in general seem to have a narrow therapeutic index. So that means that the doses at which they're very helpful and effective are may not be much different than the doses at which they can be harmful. So this is why it's always good to recommend. It's always good to work with a doctor that has a lot of experience with this.
Yeah, no, I agree. With iodine, you definitely want to work with someone. Same thing with, you mentioned iron too. So if you are going to take iron, you want to get tested first. But yeah, with iodine, I've heard both stories. I just heard people who, have taken iodine just on their own, talking about people self-treating their condition, people taking high doses and have done fine. And then you hear the nightmare stories as well. And there'll be some people who take selenium. I mentioned selenium. They'll take selenium, and I mentioned how selenium could offset the negative reaction by helping to neutralize the hydrogen peroxide. But still, it doesn't mean that if you take a few hundred micrograms of selenium along with the iodine, that it's always going to do that. So it doesn't mean that taking selenium is going to allow you to take higher doses of iodine. For some people, that might be the case. For others, the best bet is to hold off on the iodine and maybe build up your antioxidants and maybe just focus on some of the other areas, especially if someone has Hashimoto, just trying to just improve the health of the immune system before taking iodine.
Mm-hmm. And I think that's a very important point that you bring up, because a big myth is that people will say that, okay, well, iodine is fine as long as you have selenium on board, but that's not always the case. So we just want to make sure people, I don't know what that was, but we want to make sure people are educated and that people are aware of the different issues that can come up, and really working with somebody who's qualified and knowledgeable in this area, and not kind of do things willy-nilly on their own and potentially hurt themselves, because we definitely don't want that. Speaking of other kinds of myths and controversies, we're going to now get into goitrogenic foods. So things like broccoli, kale, and kind of if you picked up a thyroid book from 10 years ago or 20 years ago, one of the main things would say to not eat any kind of broccoli or kale, because for people with an underactive thyroid, because of the potential goitrogenic content of those foods. What do you recommend for your patients with Hashimoto's and for Graves' disease? Do you recommend that Hashimoto's patients avoid goitrogens and that Graves' patients eat a ton of them? What is your take on these?
Yeah, well, a number of years ago, I did tell my patients with Hashimoto's and hypothyroidism to avoid goitrogens, but then the more research I did, the more I realized that the research studies were conducted on animals, especially with regards to cruciferous vegetables, and really there were no human studies. And as far as I know, there still aren't any human studies. Now, occasionally you'll get someone who if you visit a forum or whatever, very rarely my patients, but again, you'll hear some stories about someone who had some broccoli, for example, and, their thyroid gland started to swell. But Again, that's maybe if someone has a severe iodine deficiency, potentially, but in most cases, people could eat normal amounts of these. And honestly, in most people, even if they ate larger amounts of these foods, like again, if they, these days, of course, we're in the smoothie era too. So it's common to add raw kale and raw broccoli. So again, maybe in some cases, people can overdo it a little bit, but in most people eating, definitely eating a few servings per day of, the raw goitrogenic foods. Again, broccoli, kale, cauliflower. I mean, these are really healthy foods. So usually they're not going to cause a problem. And, if you're concerned or if you think they are causing a problem, you, of course, can cook them, and that will help to reduce the goitrogenic activity as well. But also you want to eat a wide variety of vegetables anyway. So I usually don't recommend people having like 5 cups of raw broccoli, not because they'll have problems with the 5 cups of raw broccoli, but I want them to have different types of vegetables, not just cruciferous vegetables. So usually a couple of cups of cruciferous vegetables is fine, and then, mix it up with some of the other vegetables. So as far as Hashimoto's, to answer your question, yeah, I really don't tell them not to eat any goitrogenic vegetables. So I'd say, eat some broccoli, eat some kale, eat some, strawberries and spinach are also classified as being mildly goitrogenic. So I wouldn't worry too much about that. And let's remember, Hashimoto's is autoimmune. It's not caused by goitrogens. I've never seen anybody in my practice who came to me because they were eating too many goitrogens. So even if goitrogens are causing a problem, if you have already low thyroid hormone levels, and if you feel that eating the goitrogenic foods are causing some issues, it's not affecting the autoimmune response. It's not going to really worsen the Hashimoto's. So you could always cut back again if you do feel like it's causing a problem. But again, most people, that's not an issue. So to answer your question about Graves' disease, typically I don't tell people to load up with Graves' disease. I don't tell them to. I don't tell them to restrict so if they're having a smoothie, again, I'm not going to tell them, not to have a few cups. If they want to add 4 or 5 cups of raw broccoli, then I guess that's okay. But yeah, I have experimented over the years with that to see if eating large amount, because there'll be some people who, if someone has high thyroid hormone levels, typically they either want to take the medication or the herbs to help lower it. But for example, I've had some patients who are pregnant, and they can't take the herbs, or they really shouldn't take the herbs. They can take the medication, but some people don't want to take it because of the potential effects it'll have on their baby. Even though, again, everything comes down to risk versus benefits. So I never tell a patient not to take the drugs. But again, some people on their own choose not to take the medication. And so I've experimented with high amounts of raw goitrogenic foods. And, maybe in some cases it seems like it's making a little bit of a difference. It's hard to say, is it really due to the goitrogenic foods or not? But I definitely don't see that as being a replacement for methimazole or PTU or bugleweed, whatever you choose to use. Those are better options and proven options with the goitrogenic foods. Even if you could eat 5 or 6 cups of those per day, most people probably aren't. But it's, again, to answer your question, that's not something I commonly recommend as far as loading up on the goitrogenic foods for those with Graves' disease.
Yeah, so basically this is kind of a myth that these goitrogenic foods are going to be really suppressing thyroid function, which, I think back many, many years ago, they did these studies, and they basically, this myth has been carried on for many, many years. And, I think for most people with Hashimoto's and Graves' disease, these are excellent foods to have into your diet. Not something to be afraid of. And for Graves patients, not something to rely on for, suppressing your thyroid function. There is one goitrogen that I think you and I have agreed on that should not be used in people with thyroid disease, and that's soy. Can you share your thoughts on soy and why you don't recommend for people to take it or eat it?
Yeah, well, there's a few reasons. I mean, soy, as you were just saying, it is goitrogenic. Another big reason, though, is because most of the soy is genetically modified. So that's a big issue. And if you're eating whole foods, just avoiding refined foods, processed foods, then it's usually not an issue. Then you're probably avoiding soy anyway. But if you're eating any type of packaged food, even if it's gluten-free, again, there's a good chance that it has soy, which in most cases is genetically modified, unless if it says non-GMO. Or if it's organic, if it's certified organic, then, again, it should be non-GMO. But so that's another reason, goitrogenic, as well as, again, the GMOs. And then also soy has compounds, anti-nutrients like lectins, protease inhibitors that can interfere with the absorption of nutrients as well. So, I mean, I can't say I'm 100% opposed to soy, meaning that, like I'll have some people ask me every now and then, if I have a little bit of non-GMO fermented soy, is it going to be a big deal? And honestly, I've had some patients, consume some non-GMO fermented soy, and it does, again, it obviously depends on how much, and, or even like, soy lecithin is in a number of products. And if it's not from a non-GMO source, usually, unless if someone has a sensitivity, I don't usually see it as being a big deal, but I do try to encourage my patients to try to avoid soy, and especially like soy products like soy milk, soy, the soy nuggets, soy burgers. A lot of people, including myself, a number of years ago, I thought those were healthier choices. And I remember I was at one time, a long time ago, I was eating soy chicken nuggets and thought they were a healthy choice. And, but again, I do know better. And so, yeah, I think most people with these conditions should cut them out, or at least minimize their consumption of them.
It's amazing how much we've both had to learn due to our health conditions, because I used to be the same way. I used to eat, like, I thought I was eating healthy by getting tofu and all these other things, and it's just not the case. And a lot of times people will ask me about, is fermented soy okay if it's non-GMO, or they'll ask the same thing about dairy. Is raw fermented dairy going to be okay? And it comes down to, definitely that sensitivity thing that you brought up. So a person who is sensitive, who has been eating GMO soy their whole life, and has become sensitized to that protein, may still react to the fermented soy protein. If we started off just eating fermented soy protein from, organic soy, it might not be an issue as much. So I think those are some things, it's actually a frequently asked question on my website, because people will always say, like, well, he said it's GMO, but what about non-GMO? And it's kind of, yeah, it may be okay for some people, but if you've been sensitized to that protein, and soy is one of the most common reactive proteins in general after gluten and dairy, then then there's a chance that even if it's organic, fermented, and top shelf, whatever, you're still going to be having a reaction to it. So thank you for sharing that and bringing up that really important point.
Right. And I agree with what you mentioned, also the dairy too. I get that question, same thing with the raw, is it okay raw dairy or dairy from a goat or sheep? And same thing, some people do better with raw dairy or dairy from a goat or sheep, but if you have a casein sensitivity, it might not make a difference. It's so yeah.
Yeah, and I've been there and I've tried that. So I wish I could tell people that they could have these things, and because dairy's so prevalent and it's in cheeses and things like that. But yeah, dairy is going to be an issue, and goat milk as well for most people. They're very cross-reactive. The only thing is actually camel milk is supposed to have a different kind of protein. So most people who react to cow's milk dairy will be okay with camel milk. So that's a little, something to think about if you absolutely miss having milk, although coconut milk is an excellent alternative.
Now, where do you get camel milk? I have not seen camel milk in my local Whole Foods or online, I guess.
Yeah, you have to either, my husband actually got some in Dubai. He got me some camel milk chocolates there, and then you can get it online. So they ship it to you frozen. Right now I live in Boulder, Colorado, and there is a camel dairy within about 30 minutes of us, where they raise their own camels. And so it's something, that's an option for people that if they absolutely must have dairy, that's something that they can do. But, definitely making sure that you are free of your reactive foods is going to be helpful for most people. Another thing that we touched on a bit earlier and that I kind of want to get into deeper because, I know this is a very, very common trigger in autoimmunity, and that's chronic stress in the adrenals. Can we talk about your experience with people with Graves and Hashimoto's and, kind of like what testing do you do for that, and what do you see when you test your patients, and what kind of recommendations you make for them?
Sure. Well, yeah, stress is definitely a big factor with both Graves and Hashimoto's. And one of the reasons it's a big problem is just a lot of people tend to overlook it. When someone is trying to do things from a natural perspective, they tend to focus a lot on the diet and taking supplements, but they don't focus as much on stress handling. And they don't realize that, or maybe some people might realize, but they also might think that it's not a factor, that they do a good job of managing the stress. And I actually fit that category. When I was diagnosed with Graves, or before then, I always thought I was pretty good at handling stress. And then just looking back, I realized that wasn't the case. And I think stress was a big factor based on when I had my saliva tested for the adrenals, which we'll talk about. So the adrenals definitely were a big issue in my case. And stress, when looking at the research, I mean, it does seem there are more research studies showing a correlation between stress and Graves' disease, but, without question, it affects people with Hashimoto's as well. And, some people want to know, well, how does stress affect our body? And I mean, there's a few different ways. I mean, stress will definitely cause dysregulation of the immune system, can cause the increase in pro-inflammatory cytokines, which are associated with autoimmunity. It affects the secretory IgA, which lines the gastrointestinal tract. So when you're dealing with chronic stress, over months and years, secretory IgA will typically decrease. And, that can make someone more susceptible to infections, which can serve as an autoimmune trigger. So again, I mean, stress, definitely there's a physiological basis behind it, causing autoimmunity. And, if you do everything else right, if you eat great, avoid the gluten, avoid the dairy, avoid the soy, take, good quality supplements, get sufficient sleep, which you probably won't if you are stressed out all the time. But if you're somehow getting sleep, even when you're dealing with stress, a lot of chronic stress, again, you do need to get the stress under control. So that's essential. And yeah, so what testing, as far as determining if someone, I mean, sometimes, sometimes, as I mentioned before, sometimes people overestimate their stress handling skills, but some people know, and I'm sure you come across those patients too, that they know stress is a big factor and probably the biggest factor. But I still like to do some testing in this area. So I usually do recommend saliva testing to look at the adrenals. And, I know some healthcare professionals prefer urine testing, which looks at the metabolites. The reason I like saliva testing is because it's looking at that circadian rhythm. So you're collecting a sample at different times throughout the day, and with cortisol, it should be at the highest in the morning and at the lowest at the end of the day. And yeah, I mean, I see all types of different patterns. I mean, there's different stages of stress. So typically, if someone in the acute stress phase, you'll see cortisol on the higher ends, and DHEA will typically be either normal or high. And then as the stress goes on for many months, many years, cortisol usually will remain elevated, DHEA will start decreasing, and then over time, you will commonly see people with low cortisol, low DHEA, and so I'll see I'll see a test where the person has high cortisol levels in the morning, or I'll see where it's might be depressed in the morning and high at night, which is also a common pattern. So again, it really does depend on the person. And that's why you want to do testing, is because really depending on where they are, at least the approach I take is different. If someone presents with me and their cortisol levels are sky high, then I'm going to do things to help lower cortisol. Maybe give something such as phosphatidylserine to lower the cortisol levels. Of course, stress management is key. I mean, again, you could take all the supplements and herbs that you want, but if you don't manage your stress, you're not going to you're not going to improve the health of the adrenals. If someone has depressed cortisol levels, then I might give an herb such as licorice, which extends the life of cortisol. Although you do need to be cautious if someone has high blood pressure, because that could also raise the blood pressure. But it's also, we need to keep in mind that while it's, in some cases, it's a good idea to support the adrenals, you also want to support the HPA axis, which is the hypothalamic pituitary adrenal axis. Because again, the hypothalamus and pituitary gland, the pituitary gland communicates with the adrenals, and the hypothalamus communicates with the pituitary. So if you have dysregulation of the HPA axis, then again, you're going to have adrenal problems, and you could support the adrenals, but you also want to do some things to support the HPA axis, and that's where adaptogenic herbs come into play. Such as eleuthero, also known as Siberian ginseng, rhodiola is another one, ashwagandha. A lot of people are familiar with ashwagandha. But again, stress management is the most important thing that you can do. So I think it's a good idea for some people to take some of the nutrients and herbs for some support. But I see that the problem is too frequently I see people that's what they do, but they're still not blocking out time for managing stress. And if, again, I understand that, life gets in the way, but let's face it, those people who don't have the time to block out those people don't have the time to block out time for stress management, they're the people who need it the most. So, if someone, just, if they don't even have 5 or 10 minutes because they're too busy, at work, or, again, there's some, dealing with the children, whatever that they're doing. Again, I realize everybody has their responsibilities, but you need to have some quiet time, do some time for meditation, for some yoga, whatever mind-body medicine technique you're willing to do. But if you're going to start out even with 5 minutes initially, start out with, same thing with diet. Obviously, if someone's sensitive to gluten, and they might have to avoid gluten 100%, but if you're going to start out with 80%, that's still better than just eating, not worrying about what you eat. So same thing with stress management. Sometimes you do need to start out slowly and start with 5 minutes, and then once you're in the routine, then perhaps you could start increasing, to 10 minutes, 15 minutes, and eventually build up to 20 minutes, a half hour. And again, you need to do it every day. This is not something where you want to do a few days a week. I'll have some patients that say, yeah, I do some yoga. I go to a yoga studio or go to the YMCA, do some yoga, a few days a week. But then the days that they're not doing yoga, they're not doing anything. And it doesn't mean that they have to do yoga 7 days a week. Maybe they could do meditation on the days they're not doing yoga, or biofeedback. Or something. Obviously, you want to do what you like to do and what you're willing to do, but you do want to do it daily, and you want to do it when you're away on vacation too. So, again, it's something. It's the same thing with exercise. If you want, with exercise, a lot of people, it's just a matter of getting in the routine and staying in the routine, and the same is the case with stress management.
Thank you for sharing some of those ideas for people. I know. I was thinking about just different clients that I've worked with, and, people that I've corresponded with about Hashimoto's. And I found that the people that do the best usually have some sort of a stress management routine. And then there's other people who kind of, will go from doctor to doctor, and they'll do all of this testing, and they'll do, all of these nutrients and supplements and all these things, and they just kind of get stuck. And it's usually the people that have a poor stress response, and that are just, their whole life is just very, very stressful for, because of the responsibilities they have, or just maybe the stress they put on themselves. So I think that's very, very important. And you know what? Stress reduction is one of those things that's the least expensive to do. And it's something that doesn't require having an experienced healthcare professional to guide you through, but it's one of the biggest barriers that people have. So how do you convince your patients to engage in these activities? Like, well, can you tell us something that will kind of, what do you say to your patients about this?
Well, as I mentioned before, usually if someone is giving me resistance, if they're saying that they just don't have the time for stress management, And when they say that, I like that. Not that I like it, but I'd rather them be honest than to tell me they're blocking out time for stress. Because again, we can't follow our patients around. We don't know exactly what they're doing. So I'm sure there's some people who say they're blocking out time for stress and maybe aren't. So again, when they're honest and they're saying, listen, I just don't have the time, I can't make the time, so in that case, I will say, well, first of all, you need to make the time. I mean, it's not optional. You need to block out the time if you want to achieve, optimal health. If you want to, as far as, this, again, these are Hashimoto's, Graves' disease. These are complex conditions, and stress might not seem to be, maybe it isn't the biggest factor in your case, but in a lot of people it is. And again, many people overestimate their stress handling skills. So I really think it's important to at least start out with 5 minutes. And if you don't know what to do, you could rely on technology. There's different applications. Like there's one, headspace.com, where you could sign up for 10 free 10-minute lessons, 10-minute meditation lessons. So again, if someone doesn't really know where to get started, they could go to, like someplace like, again, headspace.com. And there's others like that, but that's one that I commonly recommend to my patients. And, so again, and then once they get into the routine, again, that's 10 minutes per day. If they have, everybody has a computer or an iPhone or another type of smart, again, so if you have a computer, just sign up for that. I like biofeedback. You probably have heard of heart math. But that does require more of an investment to get a device to get it installed on your computer, or I use it on my iPhone. But again, the iPhone, I find like when I got heart math, that has to do again with biofeedback. And for more information, rather than get into too much detail, heartmath.com. But I guess the point is that I have an app for my phone, and there's a piece that connects to my ear, and it goes and measures my heart rate, and it takes about a minute to set up. So it's again, I'm relying a little bit on technology, and you don't need to do heart math. If someone wants to just meditate, again, you could definitely accomplish the same thing, but again, I find myself more compliant when using a heart math, than just meditating or doing some deep breathing on my own. So whatever works for you. And that's important. If people will hear me talk about yoga. If you don't like to do yoga, then don't do yoga, because again, you're not going to be compliant, and you're not, find something you like to do. So those are some of the tips that I will give for someone who is resistant, and hope that they'll listen after that.
Well, thank you so much for sharing those. And, thank you so much for sharing your expertise and knowledge with us. I wanted to show everybody this excellent book. So this is Dr. Eric's book. It's called Natural Treatment Solutions for Hyperthyroidism and Graves' Disease. And I highly recommend this book for everybody with Graves' disease. Just make sure you guys empower yourself with this knowledge, because you really want to be an empowered patient and avoid some of the complications, potentially avoid having radioactive iodine or having your thyroid removed. So thank you so much, Dr. Eric. Just kind of in closing, do you have any specific kind of recommendations for people with Graves' disease? I'm always talking about Hashimoto's, and a lot of times people will say, well, what about for Graves' disease? Does the gluten-free diet work? Do these other things matter? Can you, maybe just give us a few tips that if you were working with somebody with Graves' disease, what kind of things have you found to be most helpful for people with Graves'?
Sure. Well, I guess probably number one is just to make sure you manage the symptoms. I mean, Graves is different than Hashimoto's and many other conditions, autoimmune conditions, in that the symptoms could be severe. And not to minimize, I work with people with Hashimoto's, but again, I should say sometimes it could be life-threatening. I mean, you could have high pulse rate, heart rate could get pretty high. So you want to do something to manage the symptoms, whether it's naturally, like something such as bugleweed, or if you have to take something such as methimazole or PTU, while trying to improve the health of your immune system, that's fine as well. So that's number one, is just making sure that you're safe, that you're managing the symptoms. And I say that just because I've had some people who don't manage the symptoms, and they just, they do other things, and again, they could get into trouble that way. Also, this is important too. I'll get into some of the dietary factors quickly, but probably second would be that if you're working with an endocrinologist, to try to work with someone who's not pressuring you into receiving radioactive iodine. You're unlikely to find someone who will be open-minded towards natural treatment methods. But again, just you want to try to, even if it's someone who's going to recommend the medication, which they probably will, if they're not going to recommend radioactive iodine, it'll probably be medication. But again, try to work with someone who's not telling you need to get radioactive iodine, that's a cure for Graves' disease, because it's not. Again, Graves' disease, like Hashimoto's, it's an immune system condition affecting the thyroid gland, and radioactive iodine is not going to do anything for the autoimmune component. You mentioned diet, so yeah, same thing as far as you want to eat mostly whole foods, pretty much while restoring your health, all whole foods ideally. Just try to not eat the refined foods and sugars. And yeah, I do recommend avoiding the common allergens such as gluten and dairy. And, so again, it depends on the person. Usually it'll be an autoimmune paleo type diet, but, some people, there's more flexibility. Graves could be challenging because there are some people are losing a lot of weight, and sometimes the autoimmune paleo diet is a little bit too strict. Stress, we mentioned stress. So stress, as I said, just as big of a factor, if not a greater factor, than eating well is just managing your stress. So, make sure besides eating great that you're also managing your stress, blocking out time, at least 5 to 10 minutes per day, if not more. And then, so those are the main things. And then we, again, try not to self-treat your condition. Try to make sure that you are working with someone who's comfortable with Graves. Not everybody is comfortable working with Graves, and a lot of that does have to do with the managing the symptoms. If someone walks into a doctor's office with a pulse rate of 120, they might feel more comfortable referring that patient out. But again, it's something, if some healthcare professionals don't want to deal with it, that should kind of give you an idea of how serious it could be at times. So it's not something you really want to play games with. So definitely work with an expert, manage the symptoms, and again, eat well, manage your stress, and those would be some of the top tips.
Wonderful. Well, thank you so much, Dr. Eric. This has been an amazing interview, and I'm so grateful for you to take the time and share your expertise with us. For the listeners at home, if they wanted to learn more about you and your work, where can we send them?
Sure. And first, I also want to thank you, Dr. Izabella, for it's been an honor to be interviewed by you. And for more information, they could visit my website, which is naturalendocrinesolutions.com. And I do offer a free guide a free guide on natural health for those with Graves' disease and Hashimoto's. And then you mentioned my book, Natural Treatment Solutions for Hyperthyroidism and Graves' disease. So that's another great resource for those with Graves' disease. So those would be probably the two resources I would mention.
Okay, wonderful. Well, thank you so much for your time, and for everybody listening at home. I'm sure that you got a lot of great information from this interview, and thank you so much for tuning in.
Great. Thanks again, Dr. Izabella.
Thanks, Dr. Eric.